Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Tara Narula. First up, January is Cervical Cancer Awareness Month, and just this week, more attention was brought to the condition.
Fox Sports reporter Erin Andrews told Sports Illustrated she was diagnosed with cervical cancer last September. Andrews underwent surgery the following month. The good news, after a procedure in November, she was told there would be no need for radiation or chemotherapy. According to the American Cancer Society estimates, in 2017 there will be over 12,000 new cases of cervical cancer and more than 4,000 related deaths. Okay, so Dr. LaPook, there was a study that came out this week. What did it show us about cervical cancer?
Well, it showed that there's a big disparity in death rate between black women and white women. We've seen this kind of disparity with other cancers. Yeah. In this case, the annual mortality rate per 100,000 women was more than twice in black women than in white. 10.1 per 100,000 versus 4.7. And people are looking at possible reasons for this. It's interesting when you look at the curve. As women get older, it tends to level off the mortality and incidence in white women. But with black women, it tends to go up. The screening, which is the most obvious thing, seems to be about the same. So people are looking at maybe the follow-up of abnormal pap smears or maybe even the kind of treatment that they get.
Tara, what information should women know for screenings?
Well, they should know that it can save their life, first and foremost. Why? Because we can pick up cancers at an early stage when we can easily treat them. We can pick up precancerous or abnormal cells at a stage where we can treat them. The death rate from cervical cancer has gone down about 50% in the last 30 years, primarily from the pap smear. So the recommendations now are starting at age 21, women should begin to get pap smears every 3 years. At 29, above 29, from 30 and above to 65, they should start getting pap smears and the HPV test every 5 years, or pap smears every 3 years. And most women can end screening around age 65. Now, there's no screening test currently for anal cancer or oropharyngeal cancers caused by HPV. And one very important thing is if women did get the HPV vaccine, they still need to be screened with things like pap smears and the HPV test, because it does not protect against all forms of cervical cancer.
That's an important thing to note. Dr. LaPook, when people think prevention, they often think vaccinations. What should people know here?
Well, Tara kind of implied it. They should know that cervical cancer is caused by a virus, the HPV virus, and there is an effective vaccine against it, and it's recommended for both boys and girls, for males and females. So yes, males can get it. Not only do they spread it to women, but they can get cancer of the anogenital region, of the base of the tongue, the tonsils, and the back of the throat. The vaccine's recommended for both boys and girls starting at age 11 or 12. And people say, wait, why so young? They're not sexually active. Right, they may not be sexually active. They usually are not. But it's most effective when given at that young age, and it even can be given as early as age 9.
Wow, interesting.
All right, up next, baby monitors that can track the vital signs of infants. The sensors can be hooked onto clothing, such as socks, and send health information straight to a parent's smartphone. However, a report published this week in the Journal of the American Medical Association raised serious questions about their effectiveness. Tara takes a look.
7-month-old Jordan Sell spent his first 3 weeks of life in the NICU, hooked up to monitors around the clock.
Bringing home your first child, born 6 weeks early, who had breathing problems, you are still a little scared.
Let's put your socks on.
They bought an Owlet baby monitor against the advice of the NICU nurses.
They thought that all it would do was give false alarms, and it would wake us up constantly in the middle of the night. And we decided to go ahead and get it anyway. It was worth every penny. We were so glad that we got it.
Devices like the Owlet are the focus of the JAMA viewpoint. Authors specifically call out smartphone-linked wearables like smart socks, onesies, and diaper clips. The devices measure babies' biometrics like pulse rate and oxygen and send those measurements to parents' apps. In a statement, Owlet acknowledged a, quote, lack of evidence behind certain products, but said they are actively addressing and resolving these concerns.
There's no evidence that they'll help kids, and there's some evidence of potential harm.
Pediatrician Christopher Bonafide is co-author of the JAMA review. He says there's no way to prove their accuracy, and they can lead to false alarms.
They could come into the emergency room. They may end up with blood tests. They may end up with x-rays. may end up with admissions to the hospital.
The American Academy of Pediatrics has also advised against these monitors to prevent sudden infant death syndrome.
We're not saying that we're a SIDS monitor at all. You can turn the alarm function on or off.
Molly and Jeff Evans created the Baby Vita monitor. The idea came after there were complications with their twin baby girls breathing.
A new parent is already anxious and already have concerns. I would rather know that something's going on with my child than not know. I think that's why these products are increasingly popular.
Tara, how are these devices regulated, and do they need more regulation, do you think?
They do, and they're not really regulated now. They're not regulated because they don't claim to prevent, treat, or diagnose. So they're able to avoid regulation in that way, but yet they make claims like, we can help you make sure your baby's still breathing, which again plays into parents' fears and anxieties. And you know, the doctors we spoke to were very clear in saying we don't know if these are safe. They haven't been tested to see if they cause, for instance, skin burns with a pulse oximetry or skin breakdown from being too tight. We don't know anything about the indirect harm. So how many of these are going to lead parents to go to the hospital and get their babies tested with blood tests and x-rays and admitted? The fears and worries it brings up in parents. And then what if they don't practice safe SIDS techniques that work because they're falsely reassured that because they have a monitor on, things are okay?
That seems very dangerous. Yeah. Dr. LaPook, smart devices aren't going anywhere, though. So how do we get to a point where doctors and nurses are actively discussing this stuff?
Well, I think we do need more discussion, more research, more regulation probably. You don't just jump into a technology because it's available. You're talking about infants and babies, and there are possible unintended consequences. Did we ask for this, by the way? The unintended
We got it, though, didn't we? We sure got it.
All right, Doctors Jon LaPook and Narula, thank you both very much.